I am Iza Suhail, the leader of our Global Perspectives project, and today I'm going to hold an interview with Dr. Faisal Hassan Shah, who is professor and head of department of Amiruddin Medical College, Lahore General Hospital. How does urban flooding contribute to the spread of mosquito-borne diseases like dengue and malaria, and what symptoms should adults be particularly cautious about?
Urban flooding hits the people in this way that there's more water on the streets and there are ponds and accumulation of water on the sides of the road that leads to the growth of parasites like malaria and dengue mosquito. So people have to be really careful when there's a rainy season because dengue and malaria have similar symptoms. People do feel chill. They suffer from rigors, and there is also associated high grade fever. But the difference between malaria and dengue fever is that dengue fever is associated with decrease in platelets that can lead to bleeding, whereas malaria is simply something that can cause destruction of RBCs, weakness associated with rigors. So they are not contagious diseases, so they cannot be spread without a vector, which is the mosquito in both cases.
What measures do you recommend to prevent and manage dengue and malaria in flood affected areas, especially where standing water may be unavoidable?
The standing water can be one option can be that it can be dried off or it can be covered with a layer of oil, because once you cover it with a layer of oil, mosquitoes cannot prosper or they cannot multiply over there. The other thing is that frequent sprays of insecticides can be done in such areas so that these areas can be cleared of mosquito eggs. So, like dengue, regarding dengue fever, what we do is that we look for points where fresh water can be accumulated, because dengue, unlike malaria, breeds in fresh water. So we have to look for sites in the community where fresh water can be accumulated, like in air coolers or places where people store clear water or clean water. Whereas the marshes, they are the hub of dengue fever, malaria fever. So you have to cover the sites according to the presence of the disease, and the management would differ in both cases.
Can you discuss how conditions created by urban flooding might increase the spread of contagious diseases like monkeypox? What precautions should individuals take?
Monkeypox is associated with a rash that resembles measles. So sometimes these symptoms of measles, monkeypox, or chickenpox, they do resemble in such a manner that it is very difficult to diagnose these diseases. So once there is a case of monkeypox, there is every likely possibility that the person staying in the same house, the persons coming in contact with the patient, they are going to be affected. So the first thing is that you have to isolate that patient to a level that there is minimal communication or exposure to other persons. Once you limit it, the disease, and you control the symptoms like fever, body aches, so the symptoms do settle if the person has a good immune system, and there are no more complications. The problem arises when the person is not aware of the severity of the problem, and he continues to communicate or remains in contact with people. So that leads to a spread of the disease in an urban populated area.
How does urban flooding contribute to respiratory issues due to mold or sewage, and what can individuals do to safeguard their respiratory health?
Respiration is all about breathing, and it is something that is essential for persistence of life. So people breathe in and people breathe out, and sometimes these respiratory diseases are associated with symptoms like cough and flu. So people have a persistent coughing problem, and when they cough, they push out those bacteria. So when they cough, they push out those droplets in the air, which contains those viruses and bacteria. So any person who is in contact or in close distance with that person, he is going to be affected because he or she inhales those droplets of infection into his lungs. And once they are there, they start multiplying because they feel that that the temperature of the recipient is better for their multiplication. And if the immunity is low, then they start multiplying over there. So what we should do is that once anybody is suffering from cough or flu, or then he or she must wear a mask and must avoid close contact with other persons who are at risk due to that infection.
Apart from what we have discussed, are there any other unique health risks related to urban flooding that affects adults differently than children, and what are some specific examples?
Children have a lower immunity as compared to adults. So sometimes the severity of the disease is greater in children as compared to adults. Adults have a better immunity. So certain diseases are specific for children, like respiratory tract infections, upper and lower respiratory tract infections, pneumonia, community acquired pneumonias, whereas adults have a better resistance. So ailing patients or ailing adults or people who are at the extremes of ages, they are more susceptible to these diseases in the extreme of seasons, like pneumonia, cough, or sometimes the smaller airways are affected, like bronchopneumonia is one problem that is commonly spread by droplet infections.
I am Iza Suhail, the leader of our Global Perspectives